Alrighty, so we have another gait video to look at today. I'm outside and there's a lot of birds and it's raining, so I'm hoping the background sound isn't too bad. Anyway, let's meet our guest for today. This is Baden. Baden is an anatomy in motion student, and this was a session that we did a few days ago now at the clinic I work at in South Melbourne, ESO Lab. So I am fortunate in this particular case that I have a before and an after video, and I also can tell you exactly what we did in our session movement-wise that created the change that you will hopefully see in our before and after. So what is Baden struggling with? His main issue is his right knee. He has some anterior medial knee pain. He doesn't really have anything else really he's complaining about. That was the priority in our session, help him get back to running without knee pain. So I don't have any posture images to show you, but what we did find, and you'll just have to take my word for it since it's not evident in the picture, but his resting posture was a hike on the right side of his pelvis, a right knee that was more flexed and externally rotated, a shift to the right of his pelvis. So that right pelvis shift is creating an adduction of his right hip. He had a abduction of the left hip. Interestingly, his left foot was more everted and internally rotated, and his right foot was a little bit more neutral. So right away, we know that this doesn't line up. The more flexed knee with the external rotation should actually couple with more of an everted foot, but in his case, it doesn't. So that was a very interesting standout. What else can I say of interest? Yes, he actually had a bit of a torsion through his pelvis. He was rotated to the right. However, he had more of a posterior tilted right ilium and an anterior tilted left ilium. So what that looked like was, from the front view, he seemed to be higher on the right side and lower on the left side, but from the back view, he was lower on the right side and higher on the left. So that ilium on the right, that the PSIS looks dropped, but the ASIS looked hiked. That is actually a posterior tilted ilium, which we know also the posterior tilt couples with that rotation towards that side. The only thing that doesn't line up is this knee with the posterior tilt of the pelvis or the ilium. It should create a knee extension and hip extension and a foot supination. So the knee really does not stand out. All right, let's clear that mess completely. And what I'll do is I'll have Baden walk full speed for us, and then I'll break it down a little bit phase by phase per the flow motion model. So in the first go at this, just see what stands out. What are the big things that you notice? Other than he looks very happy. So for me, what stands out was in the speed of his walk, or not in the speed of his walk, but with the full speed of his walk, to me, his left foot just seemed to look a bit more everted throughout his gait cycle. It's a bit more rolled inwards on the left foot. And what it looks like is, now this is his left, it looks like he has a bit more of a rotation of his spine to the left and doesn't really rotate to the right. So that's what stood out to me. Other things might stand out to you, but let's see if we can efficiently break this down. So I'm going to start him a few steps in, and we'll go in let's go into a right heel strike. So right about there, entering his phase or entering his cycle of gait on his right heel. So we're looking for lateral and posterior contact, ideally, which would be on that part of his heel. He's not too shabby, but could be a little bit more posterior lateral. We're interested in when he goes into his heel strike, does he shift his pelvis to the right? And of course, we'll have to compare it to the left, but it doesn't look like a massive shift of his pelvis is occurring. Whoopsie. What I'll just point out to you, because this is a thing that we worked on in the session, so I'll just spoil alert. Baden had an accident where when he was young, I forget, was it 5 or 6 or no, older than that, I think, grade 5, grade 4. He had a accident on his right side of his occipital bone, ended up with 16 stitches. And so to me, that seemed quite significant. Won't go fully into what we assessed there. That made it seem significant, but what I'll have you notice is that the level of his skull is not level. The right side is higher. You can see that in the level of his ears, the right ear being slightly higher. And I want you to watch that throughout this entire video. Does the level of his ears change? So going into his right heel strike, ideally what we'd see is a pelvis that is level and a spine that is laterally flexing to the left, away from the striking leg. He doesn't seem to have that lateral flexion of the spine, but he does have the head. So we'd see the head staying level on the horizon, which would be giving us a right lateral flexion of the skull. I'm wrong. He has a left lateral flexion of the skull. So sorry, Baden, this is all discombobulated in your right strike, but that's not surprising if he has a right knee that he doesn't want to step onto, and having his knee more flexed. We want an extended knee in this heel strike moment, so that could be something to consider. Does getting more extension in this knee help support all the mechanics above to coordinate better? Let's continue on. Next phase, we're going to see his right foot pronate. So roughly where his toes get fully on the ground, right there. As you can see, his spine actually is doing a pretty good job laterally flexing to the right. His pelvis looks pretty flat. I think ideally we'd like to see a tad bit more of a hike, but we'll compare to the other side. Did his foot pronate? His right foot. So we come landing on heel strike, and does his right foot roll into a rear foot eversion? It's tough to say. It's not the greatest quality of movement. I would like there to be a bit more evidence of his calcaneus everting. But if his knee is not comfortable, his body might not be pronating his foot in order to prevent that right knee from flexing too much. Now, if we look at the partner phase, which is his back leg right now, and we see that his knee is flexed, his foot is not supinated on the ground with 2 points of contact, so we're missing out some mechanics of that back leg extension. Head. He again still has right ear higher, so we still have just that little bit of a lateral flexion to the left of his skull happening here. So that hasn't changed much. We'll take note of the angle of his femur And we'll compare that to the other side when we get there, but let's have him go from here into a right transition, aka the mid stance. Sorry, brain fart. So here we go. Feet are next to each other in space. Did his foot on the right supinate? Not really. We'd like to see this foot supinating a bit more than that. And what's his head doing here? So here he actually does get a bit of a lateral flexion in the opposite direction. So he's got a right lateral flexion. However, to think about this for a moment, we want a level pelvis. The spine should be neutral, but in order to get to neutral in his previous phase, he should have been here with a right lateral flexion, which means that coming into his transition phase, he should be doing a left lateral flexion to neutral. And because the skull opposes, there should be, yes, a right lateral flexion happening. Whoops. In the skull, right lateral flexion should be happening, but it looks like it is happening in a way that he might not be, well, maybe he is level. Tough to say exactly. But in any case, there has been a right lateral flexion of his skull. So the head's moving a lot, but I don't know if his spine is really moving a lot. All right, let's go on to the next one. Does his pelvis shift to the left? We know in his static stance he was shifted to the right. So let's just have a look, see. Not so much shift to the left. Neither shifts are great, but what's maybe a little bit less good about this side is you can see, if you watch the right side of his pelvis, it goes up instead of staying level. So he actually stays with that hike adducted on the right and abducted on the left hip. We want that to be switched, shifting into the left hip to adduct it. So here's where that right hike of the pelvis becomes interesting dynamically, happening at the wrong time. His left strike foot is a lot more landing medially, and that's what I observed full speed was more eversion of his left calcaneus. Something that might be good to consider is in a static position, standing bilaterally, a shift to the right of a pelvis will result in a right foot that is more supinated, more inverted, and a left foot that's more everted or pronated. So the pelvis can drag the feet in that same direction, leaving one more inverted, one more everted. I wonder if this is what's happened with Baden. Part of what could be causing his right knee to be uncomfortable is also that his center of mass is sitting more over his right and he can't shift out of it. And this right hike, right spine lateral flexion might have something to do with it. Also in his injury history, he has mentioned he's had a problem with his right knee acutely, but he can't really remember what the injury was, but something happened. And there has been a history of back injuries, lower back, spondy, L3-ish. I forget what he said happened. In any case, what's happened with his head as he goes into his shift phase and heel strike? There seems to be quite a tipping of his spine or his torso to the left. So the right side of his pelvis goes up, but his whole spine just kind of follows instead of giving us this shape. We have this, that shape. All right, going into our pronation. Oh, that's quite a bit more eversion coming through that left foot. Let's see when all the left toes are down, right about there. Well, let me backtrack for a second because one thing just to note here is how much it looks like this femur is internally rotated. That is relevant because that femur internal rotation will contribute to greater flexion of his right knee, greater external rotation of his right knee. We want this to be a supinating leg, not a pronating leg. So we need some external rotation in that femur for that to happen well. Back on track. Left foot pronating. So his supination of his right foot is a little bit better than his left. He's got more contact, but he still has the met heads up off the ground and he still has a flexed knee back there. We can really see his head change level again here. And interestingly, he does hike his pelvis on the right a little bit when he gets onto that leg. So it's not as if he can't hike on the left and adduct his left hip, or maybe he doesn't adduct very well, but he seems to be okay. But how is that? Let's remind ourselves of the right leg forward. Ah, very interesting. He seems to not actually actively hike the right side of his pelvis as well. He seems more to kind of laterally flex to the right to get onto his right leg. He doesn't really shift his weight onto the left. He tips onto his left leg here, bit of a topple over, but he does hike the pelvis, and I think he actually does access the adduction of his left leg a little bit better. So he's missing what looks like a shift of the pelvis to the right. He does hike okay on the left. So we're looking for what's missing really to make our make sense of what we want to do with him. But before I get too ahead of myself there, let's see, where were we? We were here in his right foot or left foot pronating stance. His head is gone back into a left lateral flexion, higher on the right. And last phase we have to look at is his left foot supination. In this transition phase, where he gets to a mid stance where everything should be neutral. And this is where we see a very large left lateral flexion of the skull, right side hiked. And he seems to be hiked into the left side of his pelvis there. Left foot is a little bit pronated. Very interesting. Okay. Maybe just a quick look-see coming to the front. Rolling through, here's his left strike. Interestingly, his distal big toes, this wasn't something we addressed in this session, but they don't seem to come down to the floor, these guys. They just kind of stay up. Even when his foot is fully on the ground, his distal big toe is just up. This was a clue, actually. Big toes being up often is related, or not just up, but big toes in general, related to the skull, which actually made me ask about his skull, and that's how we sussed out his head injury was relevant. Here's him in his right heel strike. So you can see from the front view, both heel strikes, they do look like, if you look at all that activity in the tissue on the top of his feet, he is contracting some extensor digitorum longus, a muscle of eversion concentrically. It looks like he does have a more of a pronated foot shape. I'm curious about what his knee extension looks like on both sides. So there's his right strike, knees extended, and left strike, knee extension. Just looks a bit nicer, I think. Looks more loose. On this side, heel strike. Notice it looks like his patella is facing a bit more forward. And on this side, it's a little bit more externally rotated. So probably a bit more ideal this knee, in spite of this foot also pointing out. So there's some discombobulation on both sides, but what it looks like is that this knee here is certainly in need of some extension and to find the external rotation of the femur. We know this foot doesn't really pronate as well, but I wonder if just going in to work on the pronation might not be the first step because of it maybe not being comfortable. Knee flexion is something, actually knee extension is what he said was the movement that causes the most discomfort. I would imagine if he flexed his knee enough, repetitively, it would feel pretty gnarly there, but his test was to extend his knee, and that felt kind of uncomfortable for him underneath the patella and at the back. So if we look from the front view at when in the gait cycle his right knee should be the most extended, should be when his left leg is forward. And right here is when his left knee, or right knee, sorry, should be the most extended. You can see it's quite flexed. Probably because it doesn't feel good. But what's the difference between his other side? Well, that one is kind of similar. So both knees could use some extension. The only difference is, what is the difference? Well, this one flexes a lot more. So clearly avoiding that extension quite a bit. So in past sessions, what we had done was a transition phase in order to find, so transition phase is, all right, transition is when the body gets level, so it should be happening here. What we had worked on in a past session together at a study group was we had worked on finding some external rotation of the femur, some extension of the knee. Obviously, we want to just help supinate this foot as part of that pattern and getting his pelvis to rotate to the right. And that really tidied up a lot. He came in to see me the other day and everything looked a lot more comfortable and happy. Things were, things were in a different alignment than when I had seen him earlier, so that was great. Now, what is not really evident in this video is what was missing that we discovered in his movement assessments was that he struggled to shift his pelvis to the right. He struggled to hike his pelvis on the left, standing bilaterally. It's not as clear in his gait cycle that these things are missing, but what these things both have in common is a left lateral flexion of the spine. In particular for Baden, it was his lumbar spine. We found that this was actually related to his head position. And when we took the scar that was here and we neutralized it, so dragged the scar tissue into a position where it was being quote unquote released from its tight position, which happened to be in this direction. We pulled it down and left. That actually helped him feel like he could laterally flex his lumbars to the left. So maybe we'll just take a quick look at through the phases, since we know, or I know, you don't know, because I just told you, you do, but his left lateral flexion was missing in his lumbars. So this is where we should see in his right heel strike, which is interestingly right knee extension. maximum, well, not maximum, but quite a right knee extension should be happening here. And is he laterally flexing his lumbars to the left? He is not. In a right suspension with the foot pronated, we should see a right lateral flexion of his spine, and it's kind of there. It's definitely not going left, thank goodness. Here in transition, we'd want him to have a neutral spine, which would mean laterally flexing to the left. He looks pretty straight, but the movement was pretty minimal in his spine to begin with, so it's hard to say what happened there. Here is where we'd like to see in his left heel strike. This is where we'd like to see a lateral flexion of his spine to the right. Again, nothing much is really happening, or, well, that hike of the pelvis on the right is giving him a right lateral flexion, so it's kind of clear that it shows up in his heel strikes that he only laterally flexes to the right. He doesn't get to the left. Could that lateral flexion to the right be due to a past injury that is keeping him stuck there? And then that lateral flexion to the right is pulling his mass to the right and creating this eversion left foot, inversion right foot. Here is where he pronates his left foot, and we should really see a very clear lateral flexion to the left. It's not really happening, but it is happening with his skull. And his skull stays there. Here is where we should see a more neutralized spine. Nothing really changes in it. And again, we get back to the beginning where we should see left lumbar flexion, lateral flexion, and he just kind of leans to the right. So I am giving away that what we did was we did some craniosacral work to address what felt like a very dural restriction in the right side of his occiput. My hope was that this would center his head in a way that his spine underneath would have an opportunity to then do something different. And then what we ended up doing was a few movements, which I can make a video of separately. We did a few movements to help him find a left lateral flexion of his spine. So very isolated. We kind of worked in a quadruped position, so on all fours. And then we did some work standing against a wall to help him find some left lumbar flexion. And what I'd like to do next is just quickly, how do I, here we go, quickly show you the after video so you can see how things adapted to that. So if we go into this moment here, left heel strike, sorry, right heel strike, he is a little bit less leaning to the right, which is nice. His head looks more level. You can see his hair looks a lot nicer too. He looks like he is now actually maybe even pronating that right foot a little bit more. Notice it's a bit more everted looking when it gets on the ground. That's cool. We go into his right transition phase. Does his foot supinate a little bit? Still some work to do there, but there is a sense of movement actually happening in his calcaneus. Yeah, he does seem like he gets a bit more pressure towards the lateral border when he starts to come into his upright position. So there's a bit more eversion and then inversion in that right foot, which is awesome. Again, notice his head is more level. He doesn't have that big tip to the side. Left heel strike. What's the state of his foot? It was quite everted before, and it looks a little bit more like it's landing in the middle. Still some work to do to supinate that foot, but we didn't work on it, so it does need some help. What that could indicate is that the static position or the position of his center of mass between his 2 feet is now no longer shifted so far to the right, but has gone a little bit to the left and so reduced the amount of eversion on the left foot and inversion on the right foot. So he didn't really have a problem necessarily with his feet, but whoops, what am I doing? Clear. But the fact that his pelvis was so over to the right and hiked up with that right lumbar lateral flexion is it was affecting his feet. Is he still hiking the right side of his pelvis when he does his left heel strike? Not as much. That looks a lot nicer. So since we were able to give him a bit of a left lateral flexion back, he no longer is stuck like this in his heel strike. He's able to get a bit more level. And does he actually shift his pelvis to the left? Maybe a little bit more, but could use some help. Notice his head is a little bit more level than it was before. Here in his left transition, this looks like where we might have some work to do. Head level changes here. Foot looks quite a bit everted. So left foot supination, I imagine this will improve if we worked on it. So that might be the next step is to encourage some supination into the left foot and see what happens after that. So everything's looking a bit better. This right foot pronating. Let's see from the front view just what things look like real quick. Wonder if his toes are getting down more. It's hard to say. I have a feeling that his toes actually are a little bit more settling onto the earth, which would be cool if that was an outcome of working with his head and his spine. So left heel or right heel strike. Oh, that's cool. It looks like his femur is actually externally rotating a little bit more, which will help him with his knee extension. And he looks a little bit, yeah, just happier to put his mass over his right leg. I think he is actually hiking on the right a bit better. Previously, he wasn't clearly hiking the right side of his pelvis. Maybe it didn't feel good to access that because it encouraged more knee flexion and more foot pronation and just more loading through that leg. But now if he's able to get on and off of that leg, shift left, shift right, hike left, hike right. And what is that right propulsion looking like? Ah, look at that. The quality of his back knee staying more extended, supremely better. I mean, there's a lot of work to do still, but look, he has a toe touching the ground now as opposed to nothing. So he's getting more comfortable in that right knee extension, which was the painful thing. So I'm really looking forward to seeing how Baden progresses with this. What we've given him as homework is 2 movements to help him with his left lumbar lateral flexion. We've also given him a right transition movement, which, to remind you, is this phase here where he's going to rotate his pelvis to the right and feel the external rotation of his right femur going far beyond, not far beyond, a few degrees beyond his tibial external rotation so that he can better extend his knee and have a supinated foot. So he's going to work on those 3 things, as well as his right heel strike was a movement we had worked on. He's reported that his knee feels a lot more comfortable in extension. He doesn't get the discomfort under his patella. So I'm really pleased with the work that he's done to embrace these movements and the change his body has received from them. I think this is a good example of how it wasn't totally clear in his gait video what was missing, but it was a part of the puzzle, and I wouldn't have been able to pick up on that left lumbar lateral flexion if we hadn't gone in and checked his movements in a bilateral stance. So I hope that is a good learning reminder to always check the static position. He had a right hike and a right lumbar lateral flexion. He couldn't left laterally flex, and that ended up being quite significant, and so did the injury history of his head. All right, that's all I have to say about that for now. Thanks for tuning in. I'll make a little video of the movements that we did for his spine into left lateral flexion. And hope you enjoyed this video today. Have a great day. See you next time.